And for yourself and maybe for others that you've seen over the years that have made that transition?
Yeah, it's a big change. You go from working directly with patients and getting that gratification of helping somebody, that's very, very tangible day to day, to influencing the care of patients in a whole disease state area. So it's a real mind shift that has to happen in order for you to realize that you're still contributing in big ways to patient care, but on a disease level instead of an individual patient level.
So what do you say to the healthcare providers out there, and I hear this all the time, I'm sure you have as well, that say, oh, you went over to the dark side?
Get it all the
right?
time.
You knew I was going to ask that question, right?
Get it all the time.
What do you say to that?
Yeah, so I'm not going to argue about the validity of their job versus my job. That's kind of silly, right? But I will tell you that in my 20-some years in the industry, I've had the opportunity to bring more than a dozen therapies to different disease states where they become standard of care. So literally rewritten textbooks on how we treat patients based on these therapies come to market. And so although my contribution isn't anymore day-to-day care of patients one-on-one, I feel like I'm still making a valid and significant contribution to patients by helping educate and advocate for proper therapies for their treatment of their diseases.